Good afternoon and welcome to everyone as you join us for another IAFC Coronavirus Task Force webinar sponsored by the IAFC. And our guests today are, again, providing you with much information that is changing as we go on a weekly and almost an hourly basis. You're encouraged to join us every Monday at 4 p.m. Eastern Standard Time. You can register at iafc.org. And not only will we be bringing you information from the Coronavirus Task Force, but we'll also be bringing you information from our Economic Task Force as we move forward. So before we begin, this audio is being broadcast using voice over Internet Protocol technology through your computer. So please use speakers or your headset. Please make sure your speakers or headset are turned up and the volume is turned on. Up on the screen, again, we will show you if you have any difficulties, you can call our WebEx support at 866-229-3239. We're honored again to have many guests on our webinar this afternoon. I'm joined by our Corona Task Force Chair, John Sinclair. Dr. Augustine will give us the latest update information from the medical side of things. Our Government Affairs Director, Ken LaSala, will update us on our information as it pertains to legislative actions that are occurring. And our special guests, we're honored today to have Chief Keith Bryant, who is United States Fire Administrator. You will never find a better friend to the Fire Service than Chief Keith Bryant. We're honored and blessed to have him as our United States Fire Administrator. He will be joined by Starlene Black, a Deputy Section Chief with FEMA, who also will provide us valuable information today as we go forward. So with that said, I'm going to now turn it over to our Task Force Chair, Chief John Sinclair, my good friend. John, you got it.
Thank you, Gary. Can you hear me?
I can hear you fine.
Okay. So obviously this is the week that we've been dreading, and everybody knows that this is the week where we're going to see the numbers spike up. We're running into systems that are having PPE issues, and it's things that we have predicted several weeks ago or months ago, and we are there now. So as we look across the country, we also are seeing a significant rise in number of first responders that are either testing positive or in quarantine. So what we would suggest is that people continue to take a look and monitor the burn rate of their PPE. That is very vital, and it is also important that you continue to feed in through your state processes to get access to PPE. There are departments that are out there that are looking for PPE, and they are being scammed. So that's the other piece. Make sure that you go through your trusted suppliers. And, if it sounds too good to be true because somebody says, well, we've got PPE, and you look at it from the perspective of, well, nobody else does, how come you do? Be very suspect for that, because there are departments that we are getting reports that they're paying up front and they're then not getting their PPE. This is going to be a tough week ahead of us. It's probably going to be a couple of tough weeks, but we will get through this as the Fire Service and as the country and as North America. And so the one thing that we need to look at is the guidance relative to wearing a mask. And I'm sure that Dr. Augustine is going to get to this. The CDC director has stated that you should be wearing a mask when you're out in public. There is guidance from the IFF that shows that you should be wearing a mask in the station. In discussing this with our local health officer believes that if you're in the station, the thing that we should be doing is social distancing because we are having shortages of PPE. We've had a number of people that have dropped by the fire stations and said that they would create gowns and masks for us that are reusable, that can be washed. all of that is going to be down to the local level as it relates to what PPE you have, what your burn rate is, and whether or not you can, if you've got enough PPE and you can have your folks wear masks in the station as the IFF advises, that's great. Our concern is that there's not a lot of PPE in the pipeline, and it's going to be very difficult for most agencies to go with this particular order and use surgical masks in and around the station. Social isolation is one of those things that seems to be working, so that means even social isolation in the fire station, and I'm going to ask Dr. Augustine to weigh in on this as well. So with that, I will turn this over back to you, Gary, and you can introduce Dr. Augustine.
The IFF related. I'm sorry about that. Thank you again, John. I also might add we're getting some inquiries about a recommendation from the IFF that personnel inside their stations also wear some type of surgical mask. We are reviewing that, and we'll take a look at that, and we'll provide some guidance on that later on, but that is a recommendation from the IFF. I echo what John said because I'm hearing from chiefs all over the country. I learned from a chief who emailed me some information out of South Florida this morning that they only received 50 N95 masks out of 246,000 that were shipped to the state of Florida. So definitely the supply chain is strained, and so it's important that you make sure you get reputable FDA or NIOSH approved equipment out there. So now I'm going to turn over to our resident medical expert, Jim Augustine, who is also on our task force. Jim is quite knowledgeable on all these issues and has provided a plethora of information that has been very relevant to the medical situation as it pertains. And so I now turn over to my good friend, Jim Augustine. Jim?
Thank you, Chief Ludwig, and thank you all for being here today. We have a changing time right now. I'm going to focus my comments this week on questions that are up in the air and very timely, and what I've received from you as fire chiefs over the last week. The learning in the past week is in regard to United States patients, what a wide variety of presentations we're having to our fire and EMS providers. GI symptoms, meaning in particular diarrhea and abdominal pain, seem to be more common in the United States than they have been in other places. Therefore, we have to look at a broad scope of presenting symptoms for those that we're going to protect ourselves for. We also need to prepare ourselves for a growing number of patients who have been evaluated in a medical clinic somewhere or a hospital and then sent home because at the time they were stable. And very frankly, many of these patients do not want to stay in the hospital unless they absolutely have to. Being in the hospital now is not a fun time. And for some of our firefighters who have been in the hospital and away from their friends and their family, unable to have any visitors, this is not a good time to be in a hospital. What that means is more patients are at home who are known coronavirus positive. And when they get sicker, they're going to activate 911 and EMS, and we're going to have to be there and available for them. We're going to have to be prepared with full PPE, knowing that we're going into a situation where respiratory protection is advised. The single tool to take in to evaluate a patient for coronavirus is a pulse oximeter. And that is serving to be the main monitor device that lets us know how well they're oxygenating. There's a lot of surprises when it comes to oxygenation when you see these patients who may not look at a great deal of distress, but nonetheless have pulse oximetry saturations in the 80s. That has been a stunning revelation in many cases where they're thinking that their value is wrong, and in fact it's right. And many of these patients don't seem to be that symptomatic when their oxygen levels are low. Next slide. We are building models around our workforce and how we, in the heat of the battle, cannot lose our workforce. That's going to relate to how we work around our stations and work around each other. As the chiefs have said already, there's a new recommendation regarding masks. The mask is to preserve your germs for yourself. And the act of putting on a mask reflects your concern for others. We have had reports of many asymptomatic people, including firefighters who have been in the station and then spreading the coronavirus to other members of their team. They were asymptomatic or minimally symptomatic, and therefore recommendations have come down throughout the public that we put personal masks on individuals when they're around other individuals. Therefore, that would include anytime you're within the social distancing radius of another person, which is about 6 feet. The most important way to prevent getting it from somebody else and prevent spreading it to someone else is to maintain about a 6-foot radius away from them. And therefore, whether we're in the station, whether we're in an incident scene, or whether we're in the public, we need to maintain that social distance of 6 feet. If not, the ongoing recommendation is for a personal mask, and this is at the surgical mask level. There is no indication for using an N95. N95s increase respiratory effort, and you can't wear those for hours and hours at a time. And then very importantly, we're going to talk about monitoring ourselves, and I have the form later to show you that reflects us arriving at station for our shift, arriving for an incident. We get checked, have our temperature taken, and most importantly, checked for symptoms. If we have symptoms, we have to back away, be evaluated fully related to our departmental procedure. Next slide. This is kind of a complicated slide here, but I want you to realize we're building models of what this coronavirus looks like across the population. There are people with minimal symptoms. There are people with minor symptoms. There are people with severe symptoms, and some of those severe moving into critical care and on ventilators, as you have heard. We know that for the first couple days after exposure, you neither have symptoms nor are you infectious or contagious to others. But at some point you become infectious. At some point you begin having symptoms. In most cases, you go through a period of time where your body is fighting this infection internally, but you're still able to spread it to other people through droplets. And then you're building immunity to it. Through the course of this, many people, 80% plus in the American population, recover and are fine, but 20% end up in or near a hospital, and about 2% overall end up in critical care. And in critical care, that still has a high fatality rate. Next slide, please. Our immediate approach to all patients in regard to this is to put a surgical mask on the patient. The single most important thing that we do to prevent infection is to put a mask on the patient. That again is a surgical mask or face cover. It is not an N95. And then as we move in, we have our own protective wear on, which should include an N95, using a pulse oximeter on the patient. I was asked to repeat again the recommendations about nebulizers. As most of the country heads into allergy season, there are still going to be a lot of patients who we see who have routine run-of-the-mill asthma, we think. But in case they have any infectious symptoms, what we need to remember is all nebulizer treatments need to occur in an open air space, and the droplets that come out as part of either the vapor in the nebulizer itself or from the patient coughing means that those are potentially infectious agents. So our crew members need to be at least 6 feet away as the nebulizer treatment is going on, and those droplets falling on the patient's clothing could then later, for some time, minutes to hours perhaps, be able to be inhaled by our crew members. Therefore, if you'll put the patient's sheet or something equivalent over their clothing, leave that at the scene, then we have a relatively clean patient who's now in transport in the back of our ambulance unit. Next slide, please. Our 911 challenges. Again, safe operation of the 911 dispatch center. A growing number of communities are building no response processes. So for those of you familiar, these become omega calls. And instead of sending a unit to the scene, instead those people are routed either directly to public health through a warm handoff, or they're put on a list and public health goes to that member depending on the community's ability to respond. In either case, we are not sending units to reports of relatively minor processes that we think are related to coronavirus, and instead using an alternate process. All of you should be aware of that and discussing it with your medical directors and with the local health systems. A reminder that any of our senior care sites, whatever we call them, are the huge risk for people dying. There is a need for them to develop nurse or physician evaluation in-house rather than 911 respond and transport. It is also a good idea if you're going to these as a fire EMS responder that you ask the staff to move the patient to a warm handoff site, typically at the threshold to the building or outside the building, and therefore our personnel are not moving into the building. Our senior care facilities are a site of many too frequent deaths at this point and in the coming weeks. Next slide. Our testing is finally becoming available, and there's two forms of tests. I don't want to go into any of the details of them now, but be aware there are blood tests and there are tests where a swab goes in the nose. Still, the very most important test that we are doing at this time is a swab in the nose looking directly for the virus. So this is like you at the scene looking for fire, and I want to find fire, and so I go looking for fire. Instead of looking for other ways that we can see whether the fire was there. So looking for char marks later on. That's in effect what we're doing when we look for antibodies. It takes a period of time for your body to fight off an infection and to create markers that it fought an infection. Those are called antibodies. There are many diseases we deal with in the service that relate to us looking for antibodies to see if we have protection. Last week, I used hepatitis B as a sample of how we, very importantly, immunize our fire EMS staff, and then years later go looking to find evidence that they still can fight hepatitis B. That's the same theory behind looking for antibodies to a coronavirus. At this point, we don't have all the answers, and what we do know for sure is that there is a lag time between the time that you have the infection and the time that antibody tests will show it in your system. Next slide, please. Therefore, you're going to see some slides that look like this, and I intentionally don't highlight this slide because this is not the process that we are advocating at this point. But if you think about early on, what you look for is the virus in the patient or our provider's system directly, and we get a yes or no answer, is it there or not? Later on, we will be looking for evidence through a series of antibody tests that see whether the person who was sick in the past, maybe weeks ago, has now recovered and has protection, at least for the short term, against this. So you're going to be seeing graphs like this, and I think all of you should be aware right now you're going to receive an inquiry from somebody who wants to sell you antibody tests and tell you that you need them now. And I urge you to have a very serious discussion with your local hospital provider, occupational medicine provider, or operational medical director, because these are not acute phase tests at this point. Later on, they will become very important, and we will provide you guidance about how to use the point of care test for the virus itself versus the antibody tests. Next slide. Personnel quarantine and isolation. So now we are at the point, and there's great stories now, fire EMS people actually in hospitals very ill. Fortunately, most fire EMS people who've been positive are not that ill and can be treated in another location, either in their home or another site that has been picked out by your department or for the community. A reminder again, the logistics that are needed to support that individual, both physically and mentally, are very important. And each of you should have a tracking form for each of your members who go into the quarantine isolation process. The key numbers are at least 7 days from onset of symptoms and at least 72 hours since the last symptoms before that person is a candidate to return to work. Many cases, we're looking for a total of 14 days of monitoring people after they have been exposed to make sure that they move through the entire period where we believe a coronavirus infection could show up. Next slide. Around our communities, a lot is going on, and some of it is brand new to us. In my community down here last weekend, Friday evening, we have a lot of rental cars that aren't moving in the fleets. They decided to park them in a field. And what looks like now began as a hot exhaust over the top of dry grass that produced initially a small brush fire that turned into a 3,500 car conflagration. And if you think and price out 3,500 new cars, that is a $100 million fire that occurred because of the anomalies in our usual system of moving cars through the rental car system. Last week, I highlighted the potential risks of alternate hospitals going up in your communities and asked you to think through with your fire investigators and your inspectors, what are the potential hazards at those sites. There's all kinds of things going on in our community that we are not used to doing and represent a risk to our usual way of doing business. Here is a $100 million fire as a result of one of those changes, and should be a highlight for all of us how quickly things can go sour. I thank you all for the opportunity. Please keep the questions coming to me. How can we serve our members and therefore serve our communities better? That's our focus as we move through this. Chief Ludwig, thank you very much.
Thank you, Jim. Wonderful information. Again, we are so appreciative for all that you do for us and all the information that you provide for us. It's always timely and it's always new information every week. I'm always amazed by that. Thank you, Jim, so much. Now I'd like to introduce our Government Affairs Director at the IAFC. Again, the IAFC has 3 individuals that work in this office, and they storm Capitol Hill, they storm the White House, they storm other government offices representing us and seeing what they can do to impact legislation that's favorable to the fire service. So with that said, one of the hardest working men I know down at the IAFC, I'm going to introduce him right now. His name is Ken LaSala, and he's our Government Relations Director. Ken, you have the floor.
I just have one slide, which will be pretty quick. I guess moving on to it. Basically, when I talked last week, we had discussed the fact there was $100 million in the AFG program to help with COVID response. It was something that Congress appropriated as part of the CARES Act. Working with the other fire service organizations, we sent a letter last Thursday asking the U.S. Fire Administration and FEMA and the grants office to move forward and to start issuing those AFG grants, and then also take care of some of the safer grants, some of the old fire grants that still have yet to be to have the application period go. The good news is it looks like there's going to be some motion by FEMA. The fire groups are having a meeting with the AFG program office later this week, and hopefully fairly soon we'll be able to start announcing some application periods coming up. In addition, we had discussed the fact that in the CARES Act, there's $100 billion in the Public Health and Social Services Emergency Fund for Medicare suppliers and providers to get reimbursed for their expenses in treating COVID patients. So today, the fire service organizations sent a letter to Secretary Azar over there at HHS and just asked him how he's going to start the rolling application process, which Congress mandated. So as we get more details from HHS, we're going to go forward with that. And then the final thing is Congress is starting to look at doing a fourth bill for COVID response. I'm sure you all saw Chief Ludwig has put out a call to action. And one of the things we're going to be working on for the fourth COVID bill, and we'll have more details as we go forward, is basically creating a dedicated fund to directly fund fire and EMS departments as they engage in COVID-19 response operations. So that's something which we'll have more details on, probably, during this week. But we appreciate everybody's hard work. And at this point, I'm going to turn everything over to Chief Ludwig to go introduce Chief Bryant, who's going to have a very important educational session here on cost recovery.
Thank you, Ken, for all that great information. And as Ken alluded to, there'll be more to come. You'll be hearing more as we make efforts and attempts to recognize or have the Congress recognize this and our needs as it relates to backfill for overtime, the other issues that impact us with PPE, that our overtime budgets have been drained, our supply budgets have been decimated, and we'll have more on that as we go forward. But thank you for the information, Ken. So now it's my honor and privilege to recognize our special guest, which is this afternoon, which is our United States Fire Administrator, which is Keith Bryant. And as I said before, and I'll repeat it again, we couldn't find a better friend of the fire service than our current administrator, and that's Keith Bryant. And I'm honored to call him a friend, and I know he's a hardworking gentleman who is constantly pounding the steps up there in Capitol Hill again on behalf of the fire service. So, Keith, I'm going to turn it over to you and allow you to introduce your staff member that's with you.
Thank you, sir. And I want to say how much I appreciate everyone for joining the call today. There's a ton of information going on out there back and forth. And, we want to do our part because the United States Fire Administration, we are solely focused at the state and local level of providing support and assistance. So we want to make sure we're doing our part and get as much good, accurate, timely information as we can. And with that, again, I'll say thanks to my friend Gary, Chief Ludwig, and my friend John, Chief Sinclair, for allowing us the time and the format this afternoon to visit about some important things about how, as we respond to this pandemic and the circumstances that we face, that we maybe provide some assistance and provide some information on how you can recover some of the costs associated with that. So next slide, please. Thank you. So as far as we know, to the best of our knowledge, this information is current as of this webinar, but obviously this is a dynamic, rapidly changing situation, and the Fire Administration, FEMA, we will continue to do our best to keep you informed as to whatever the current circumstances information that we need to communicate to everyone is. Next, please. The widespread global nature of this pandemic is challenging us in ways that, some of us, if not all of us, have never even seen before. And, you want to think about disasters, even though some of the more large-scale disasters such as earthquakes, hurricanes, wildfires, as big as they may get and as wide an area or even a region they may impact, they're still, especially compared to what we're dealing with now, localized. I don't know that I've ever seen a situation where all 50 states were under a disaster declaration for the same thing like this. And again, it extends globally, which is, again, taxing not only the resources that may be available to us and causing them to be in short supply, but the demand for those things as well. We're having to make adjustments in how we respond and all those things that we've been required to do as a result of this. And you can go to the next slide if you'd like to. Because of those impacts are going to be unprecedented as well. With that, what we want to do today is provide you a condensed version of our National Fire Academy Administration of Public Assistance for Community Recovery class, usually a 6-day offering on campus there at Emmitsburg, but we're going to try and condense that down in as short a time as possible to give you as much information as we can about how to track the cost of this pandemic to your organization and make sure that as you apply for reimbursement that you know what's reimbursable, what may not be, and that you, again, have the guidance that you need to make sure that you have the best chance of success of recovering those costs. So with that, I'm happy to introduce Deputy Section Chief for FEMA's Public Assistance Training Office, Star Black, who's going to take us through the program today and give you as much information as we possibly can on what's involved in cost recovery. So with that, I'll turn it over to Star.
The agenda of what I'm going to be covering today is what is the public assistance process for COVID-19. I'm also going to cover the public assistance eligibility. I am going to talk about public assistance overall, and then I'm going to get into the specifics of COVID-19. Also, administrative relief, what we are doing for procurement to help you out. I'm also going to be talking about documentation. What kind of documentation are you going to need in order to get that FEMA grant through? And then what are the next steps? What do you need to do after this webinar? So let's go ahead and get into the specifics for public assistance for COVID-19. First off, what is public assistance? Some of you probably have gone through a federally declared event, and some of you may never have. And some of you have seen it and you just walked away from it. Well, this is a chance for you to find out exactly what it is. FEMA's Public Assistance Program, what it does is it provides supplemental grant to state, tribal, territorial, and local governments and certain private nonprofits so that communities can quickly respond and recover from major disasters or emergencies. And that's exactly what we're in. So that's FEMA's main mission. The declaration, just so that you can have the facts, the date of the national declaration was March 13th, 2020. The one thing that you do need to pay attention to is the incident period. It's January 20th, 2020, and it is still continuing. That date is when you start incurring cost for COVID-19. So you're probably going to have to do some backpedaling as we get into documentation on what you need to track. It is the coronavirus disease or COVID-19 pandemic. It's all states, all tribes, territories, and the District of Columbia. Now, one thing to keep in mind is there is a cost share. FEMA is providing 75% of the federal, and the non-federal, which will be what you will be responsible for, is the 25% of the total cost. Now, what's the process? The process for the COVID-19. Now, we are actually streamlining our process for COVID-19. You will attend a virtual applicant briefing, which the state will put on for you. You will log in to create your account. You'll submit your request for public assistance, and I'm going to get into this a little bit further on how you do that. You submit your documents, and we are again streamlining this process for you. And FEMA and the state, or it may be FEMA and the tribal nations that come in as a recipient, review the documents, we sign the final grant, and away it goes. So as you can see, this is a much, much streamlined process that we're doing for COVID-19. Again, this is different than our normal public assistance declarations like you would see for a tornado or a hurricane. Again, now what's going to be nice is if you don't already have a grants portal account, you need one. The reason why is this is how you're going to be able to track your grant. You're going to be able to see it from beginning to end, and you're going to see even where it gets hung up. You're going to see when we need additional documents. So you need a grants portal account, and that's going to be at https://grantee.fema.gov. And again, I'm sure this will be posted on the webinar portal for you. You will be, if you don't have an account, you'll be able to go in directly and be able to submit and create an account the state or tribe will review it as the recipient, and FEMA will review it, and then you'll be underway. No longer do you have to wait for an invitation. So if you don't have an account, you need to get an account. If you have an account, then all you need to do is to go in and do your request for public assistance. We have a bunch of quick guides. We have some how-to videos. They're all going to be located there on what we call the splash page, what some of us know it as the login page, on the grantee.fema.gov. And if you've got any questions about the software, not necessarily eligibility, but the software, the grants portal, you can actually call the hotline. We have folks standing by to answer your calls. That's the 866-337-8448. And again, that'll be up at the end of the presentation. If you have any questions about establishing your account, or you get locked out, or you're not sure what you're seeing in Grants Portal, they're there to help you with the software and getting established. If you are a private nonprofit, I know that some of the fire departments are actually a private nonprofit. If you're a volunteer fire department and you're officially recognized by a legally authorized, being a state, tribe, or territory, to cover specific areas, FEMA may reimburse the volunteer fire department directly as an eligible applicant, so you need to establish an account. Unfortunately, at this time, tribes and territories cannot establish, tribes and private nonprofits, sorry about that, cannot do the direct application. They need to contact the either the state emergency management representative to get your account established. We're working on that, but if you're a municipality, you can go ahead and do the direct. The reason why private nonprofits right now are not able to do direct application is we need a lot of documents to establish your account. We need a copy of your charter or your bylaws. We need proof of nonprofit status. And then also there is a private nonprofit questionnaire, which is located on the FEMA.gov site, that we need to have before we can establish your account. Now, the nice thing is once your account is established, it's good. You don't have to go through this process again. So, so that's kind of a nice feature. Now, what you're going to see when you go to Grants Portal is this is what we call the splash page or the login page. You'll also see where you can click on to find the videos. We have all kinds of how-to videos to do this. But you're actually going to click on right below where it says sign in. You'll see a little blue link, not the sign in bar, but right below the sign in to register your organization. Again, if you already have a login and a password, just log in and do your request for public assistance. When you establish your organization, what's going to happen is once you click that you want to establish it, it's going to say, if you're an individual, here's where you need to go. If you're a business, here's where to go. If you're a tribal government, here's what you need to do. If you're none of those and not a private nonprofit, then you get to click that you're not a robot. Not to say that anybody on that list is a robot, but it's just that little confirmation to show that that the bots aren't out there scanning our software. So you actually have to check that box. And then once you check that box, it's actually going to take you through several tabs. You can see that basic information, the operations, the organization, some contact information. What it will ask is what state are you in, and then which event. Make sure that the event you're choosing is the COVID-19. You'll see that in parentheses, and then you'll just tab through that as you click the next button as you go through. Again, if you've got any questions at all, or you're not sure, you can always call the hotline. They will be available to help you. So now that that's the process, we're going to walk through the eligibility. What would be eligible? How you're going to see this little pyramid, the applicant, facility, cost, work, and cost. You have to get a yes all the way to get to the grant. So an eligible applicant, we've kind of lumped these together as applicants or subrecipients. They can be state agencies, territorial governments, tribal organizations. State, tribes, and territories can be a recipient and a applicant, or you'll also hear it referred to as a subrecipient. Counties and parishes are applicants and subrecipients, municipalities, cities, towns, boroughs, townships, and the list keeps going. Local public authorities, school districts, special districts under state law. I know some fire departments are under a special district, and certain private nonprofits. So this would be if you were a volunteer fire department with the authorization. The activity, what are you doing? It has to be, and this is for all FEMA public assistance grants, it has to be required as a result of a declared incident. So this can't be just your normal calls that you're doing. It has to be located within the designated area. And with this event, it's the entire country. So I think you're covered on that one. And it must be your legal responsibility to perform those activities. Now there is a fact sheet that we have put together. It's for COVID-19 pandemic eligible emergency protective measures, and I'll talk more about that as we get through this. Some PNPs may be eligible if they are legally responsible for performing emergency protective services. So again, that private nonprofit or the volunteers, that you own or operate an eligible facility, perform eligible work, such as providing emergency medical or custodial care, in which you're legally responsible for due to COVID-19. Now, what is eligible under COVID-19? For public assistance, we actually have Category A, which is debris removal. That is not part of this COVID-19. And neither is the permanent work, which is what we refer to as our Category C through G. But what this declaration is all about is Category B, emergency protective measures, which is usually what the fire department falls into anyway. What Category B is it's to eliminate or lessen the immediate threat to lives, public health, or safety. So that's the definition of emergency protective measures. Now, let me get into a little bit more of what that means. If you were working in the EOC, any related costs for that, or even establishing an EOC, medical care and transport, evacuation and sheltering. I know that there's been a couple of questions about non-congregate sheltering regarding hotels and things of that. Well, I actually will have on the webinar portal, we have a fact sheet about non-congregate sheltering, and it'll give you more information than you want to know about what would be eligible and what's not. Supplies and commodities, that would be your medical supplies, your PPE, those kinds of things. That all falls under Category B. Also under Category B is the big one here is decontaminating public facilities, and that includes your emergency responder vehicles. So you need to track all that information. Also, if you've purchased or distribution of food, ice, water, medicine, other consumables, hazmat suits, those types of things. To be eligible for reimbursement, again, the cost must be incurred for doing eligible work. So it has to be directly related to COVID-19. It has to be adequately documented. Again, we're going to reduce it by any insurance proceeds or any other credits. It must be authorized and permitted. And it's got to be consistent with your internal policies, regulations, and procedures. And the biggest one is it has to be necessary and reasonable to accomplish the work. So you can't get that gold-plated, beautiful mask. That N95 mask will work just fine. Again, reasonable cost. The applicant is responsible for providing the documentation. And what we determine as reasonable cost is what a prudent person would do at the time that they incurred the cost. So that's what we look at. Also, we make sure that there's no duplication of benefits. Next slide. We want to, because HHS, their Center for Disease Control and Prevention, or the CDC, they are providing some funding source. We also want to make sure that any other services that are covered by the Department of Health and Human Services is not duplicated. We will look that over. What your biggest task is to actually document everything. We will look at that. We just want to make sure that there's no duplication, that there's, you don't have both hands in both pockets. Insurance is another duplication. We want to make sure that if you have an insurance policy, that it does, some insurance policies, as crazy as it is, will cover this. So we will ask for your insurance policy. And if claiming cleanup or disinfecting of any property, sometimes it is covered in your insurance policy. Again, we just want to make sure that the money you receive is the money you get to keep and that it's not a duplication. And for this event, there is no obtain and maintain requirements for emergency work. So you don't have to worry about having an insurance policy following this. Again, as I mentioned earlier, there is a cost share. The federal share is 75%. You will be on the hook for the 25%. But I may have a way that you can help reduce that 25%. And that would be by donated resources. This will offset your 25%. You have to track this, all donated resources. So any volunteer labor, if you have any volunteer responders, if you have any of your CERT team members, if you need to track their name, the date, the time, and what they were doing, and for how long. Those are the things we need in order to document that towards your 25%, for offsetting your 25%. So if you had any amateur radio operators, anybody donated any equipment, donated any supplies or materials, or provided you any logistical support. So anything that was donated, log it, track it. We want to make sure that we can offset that 25% as much as we can for you. Now, we do know that doing a FEMA grant for public assistance is an administrative burden. We realize that. So we are going to give you up to 5% of the total grant amount, and that's based on the actual cost. So not the split, but the 100%. And that includes things like the meetings, anything that has to do with that PA claim, any correspondence, reviewing any projects, uploading your insurance document, uploading anything, or even any types of training. There is a link here for management costs. I know probably some of you have been already contacted by consultant firms. That is between you and the consulting firm. We know they're out there. What they offer is convenience. However, we have streamlined that COVID-19 process to where it would be less of an administrative burden. And you will also be assigned a FEMA program delivery manager to walk you through this. But again, it's strictly up to you. We are going to only give you up to 5% administrative cost. So keep that in mind if you're considering using one of the consultants. We will work with them, or we will work with you, or we'll do both. All right. The administrative relief, now I'm going to go into the procurement piece of what we have done. We know that we typically require that you do competitive bids. However, for the COVID-19, if you have entered into any contracts for a sole source to provide you anything, we are waiving the process of having to do putting it out to bid for COVID-19. So that memo came out March 17th, but it's back. We're backdating it to any contracts entered into or used on or after January 27th, 2020. Again, procurement, it is an exception. It's for exigent and emergency circumstances. Follow the time and materials contract requirements if at all possible. We ask that you do not enter into a cost plus percentage contracts. We don't like those because there's no incentive to keep the cost down. You need to award the contracts to a responsible contractor, and again, follow all your oversight and conflict of interest requirements. Basically, just make sure that that you have a ceiling and not to exceed amount in your contracts if you're going to use them. Again, we don't prohibit time and materials. We just find that they have a likelihood of unreasonable cost, and so therefore you might be jeopardizing your grant. And so if at all possible, try and stay away from this. So what kind of documentation do you need? There's a lot of different types of documents. Once your organization has been approved in Grants Portal, we're going to need some what I call master documents. These master documents will help us determine what I know, because firefighters, your pay policies are a little bit different than your normal Department of Public Works. You work some really interesting shifts. So we need to know what that personnel pay policy is for overtime, if there's any labor or union contracts, and then we also need the insurance policy. Again, we're going to go in and dig through and review it all. We just need you to provide the full pieces of those documents. The biggest thing you can do is start now. Start tracking all your COVID-19 activities. That includes the regular hours and the overtime hours. Make some type of notation of which hours, or even up to a 15-minute interval of which ones are COVID-19 activities. Your call logs are going to be essential. What we have to do for the fire department that's very different is we have to sift out what the difference between a COVID-19 and then what would be a regular call that you would go on. So we're looking for the COVID-19. We need to know what equipment you used on a COVID-19 call, including the apparatus you used, any supplies, any materials. Did you have them in stock, or did you have to go out and purchase them? Now, the other nice thing is you don't have to put this on a FEMA form. There has been created, and again, this is going to be on the webinar portal for you. the Disaster Response Cost Recovery Excel workbook. So if you're, want a simple way of tracking things, we will take that. We will take the FEMA forms, or we will take any other way that you can get us that information. So how it's put in there is not important. It's what's put in there. It's what we need. The other big thing to remember is once we get through all of this, don't throw these documents away. There is a 3-year limit. I recommend you just hang on to them because you are subject to an audit by state auditors, FEMA, the Department of Homeland Security, Office of Inspector General, and the Government Accountability Office. So just hang on to these documents. So what's the next step? So where do you go from here? Now that you've got a great overview of public assistance, what we're looking for, documentation, you can even start backdating, going back in your records to calculate everything from January 20th. But start now. The biggest thing to do is get that grants portal account. Access grants portal, create an account, submit your request for public assistance. That's the RPA, request for public assistance. If you already have an account, log in and you'll see where we call it the yellow brick road, where it says click here to submit a request for public assistance. That puts you on the FEMA radar. You need to do that first and then get your documentation together. Again, as you saw at the beginning, it's only going to take about six different next buttons to set up your account and do that request if you don't already have one. Now, we have put together some wonderful videos for you. They're short. We put them on the Grants Manager YouTube channel. Again, this will be posted up on the webinar portal. I know it's kind of a crazy address there, but these are short little webinars to take you through what to do, how to do it, and then again, any technical support for the software, call 866-337-8448. Or if you just want to send an email regarding grants portal, it's FEMA-recovery-PA-grants@fema.dhs.gov. And those, again, are for any grants portal, the software questions. And now I guess I will hand it back to Chief Bryant.
Thanks, Star. And again, appreciate you taking the time and being with us all today and providing that information. I want to repeat before I end up, or before I finish up on this next section, by letting everybody know that all the information, the links, and so forth to resources and guidance will be on the USFA website, in case you may have missed it on this webinar. So I wanted to take just a few minutes as we end up here today and talk a little bit about PSOB. I know that's came up in recent conversation in the news, especially with the tragic loss of our brother in New Jersey. And so there's been some discussion about would any line of duty death as a result of exposure to COVID-19 qualify under the public safety officer benefit. So next slide, please. Very high level. Obviously, those are the types of organizations and activities that are eligible under PSOB. Obviously, for us, fire and EMS. But there's also certain support personnel, such as fire chaplains, as an example of that, who are also eligible. Next, please. And the benefits under public safety officer benefit. Obviously, there's a survivor death benefit for the surviving family of the member, permanent disability benefit, where that applies, and an educational benefit for the children or the surviving children of a lost member. Next, please. This is maybe the most important slide in this little piece of this talk this afternoon. For eligibility, or under the PSOB claim chain here, you have to be an eligible responder. You have to be on duty. And that exposure equals proximal cause, very, very important. And again, a lot of conversation over the past several days about eligibility under PSOB. Everything I'm hearing, the answer is yes, provided there is a very well documented exposure to COVID-19 virus. And then obviously that has to lead to death or disability. Next, please. Under the Code of Federal Regulations involving PSOB, a traumatic physical wound, or in our case now, an infectious disease, radiation, virus, or bacteria. Next. And again, here we go under the documentation of exposure, when, where, what activity or what function was being performed, and what level of PPE was being used. This, again, can't stress enough how important this documentation is. Next, please. And then other documentation of the illness or diagnosis date, however the person is treated, and the outcome of that will go into the claim requirements as well. Next. Under the agency, the notice of appointment, and that means the date or when that person became a member of that agency. Incident documentation, what the person was doing, how they were assigned, and so forth. Notice of exposure, when did they become aware that they were exposed or injured? And again, the supporting documentation in terms of PPE, any policies, procedures, and guidelines within your department or agency of how that PPE is supposed to be used and under what circumstances. Next. Some of these guidelines are still under develop right now, but there could be an autopsy requirement. Death, disability due to other causes that might be secondary to the primary cause of COVID-19, and a death certificate of causation documentation. Next, please. Here's some additional resources. Again, a lot of discussion that's been going on is within these groups, but certainly the National Fallen Firefighters Foundation, the PSOB homepage are also good places to go and look. And maybe if you have any questions in terms of exposures, documentation, that type of thing, you can certainly go with one of these resources. Next, please. So again, I want to thank the IFC for the opportunity today to be on here and talking to everybody. A couple of very important things. Certainly, as we go through this, there's going to be a lot of costs associated with the response to this. We hope we've shed some light today on how you can go about being reimbursed for those costs. Certainly, at the point, hopefully sooner rather than later, when we begin to de-escalate a little bit, this is going to be very, very important. If you don't have somebody right now that's assigned to capturing all this information and making sure you have good documentation when it comes time to apply for reimbursement, I highly suggest you do so. I know some people are strapped in terms of everybody's assigned as far as personnel, and that's a challenge as well, but I can't, again, stress enough to you how important this is so that you can recover those costs as you try and start getting back to normal operations. With that, again, I want to say how much I appreciate everybody's attention this afternoon. I certainly go back to Chief Ludwig and his leadership of the IFC during this pandemic and the information that's going out from them. And we're very happy to have the relationship that we do with the IFC and to be working with them and so many other groups during this time. Seeing some really courageous, inspiring stuff going on out there, and I can't begin to express my appreciation for the professionalism that's being demonstrated by our fire and EMS personnel. Chief Ludwig, back to you, sir. Thank you very much.
Thank you, Chief Bryant, and thank you and Star also for that vital and very important information we received. For those that don't know it, Chief Bryant is a former president of the IAFC also, and I'm honored to follow in his footsteps. He certainly was a role model for me to follow as an IAFC president, so thank you, Chief Bryant. I also want to thank all the panelists today who provided terrific and outstanding information, and again, special thanks to our special guest today, United States Fire Administrator Keith Bryant and Section Chief Star Black. I also want to thank Chief Sinclair and all those members on the task force. Finally, I want to thank our interim CEO, Rob Brown, and the members of the the IAFC staff who are working very long hours and weekends. If you have any questions, if you're listening today or if you listen later to the rebroadcast of this, if you have any questions, please email covid19tf@iafc.org. Again, that's covid19tf@iafc.org. As a reminder, we will be doing these webinars every Monday at 4 p.m. Eastern Standard Time. We'll also include economic information from our Economic Task Force in the future. In order to register for these webinars every Monday, please go to iafc.org to register. As I always say, I'm honored to serve in this noble profession with so many outstanding people who make a difference in their communities every day. Please join us again next week as we have another webinar and we will provide the latest updates and vital information. In the meantime, everyone, please stay safe and may God bless these United States of America.